Everything starts with a consult in any form. It could be in person as well as it could be through a phone consultation. It's the same as going to the physician. It's the same thing. We review the records, we review the case, we listen to what the patient has to say, not just with the records, it's also what the patient has to say about their journey, what they have done, what they haven't done. In other words, the overall status quo of the situation. So first is, again, the consultation, so we can receive the information, get an idea of also what the patient is open to. Again, it's not about the disease, it's about the patient. We have a meeting and the specific team of physicians or the core team, and then a medical decision is decided, possible treatment plan, and then we present this to the admissions department, which presents this to the patient. And if they believe we're the place, then I believe it's a quite quick process in which we don't have any waiting list because of the size of the hospital, because of who we are. So patients can come immediately to receive medical treatment, and their stay, it could be in the hospital as well as an outpatient. We have both possibilities. Patients can choose, of course, that if they're stable. I can decide if to stay in the hospital or maybe to be an outpatient, but there's patients who require a stay in the hospital because of their condition. So in this case, we also have those two possibilities, being an outpatient or an inpatient. Cancer, it doesn't present itself as a one-size-fits-all. Not all women that have breast cancer are experiencing the disease in the same way. The only thing that they have in common is the tumor in the breast, or that everything started somewhere in one of the breasts. But the rest is pure differences. So here it's a tailor-made approach to the disease. So depending on the situation of the patient, we tailor-made a treatment. This also involves a very important situation, which is what the patient has to say. We get to that point in the conversation in which we discuss that it's not easy to make those kinds of decisions of leaving your country, or to accept that you're not going to get the help that you require in your country and you need to look other ways. Typically, we get patients from first world countries, Australia, New Zealand, the States, Canada, the UK, and well, Mexico still has this international view of a third world country. Many of the family members, some of the friends, can question why you're doing that to the patient. Why are you doing that? Think about that. So it comes down to being very clear, being as much as we can transparent in relation to what the hospital can offer, to answer all of their questions to their satisfaction. And that's as far as we can go. And then the rest, it's a personal decision. It becomes this leap of faith in which I have heard it many times over the years, that the call, this connection that we make during that initial consultation is very important. Where does the patient feel comfortable also? Because they're not just looking for medical help, they're also looking for emotional comfort that comes from the physician, theoretically speaking, which is, for some reason, we're losing it in hospitals, quality of medical care, or the humanistic part of that.